morning, podcast listeners. Welcome to the Chamber Connections, connecting businesses with the community. Today, we have the pleasure of sitting down with Dr. Mohammed, Osman. Today, we're going to spend a lot of time talking about cardiac manifestation in COVID patients. So, good morning and welcome, doctor, and thanks for joining us today.
Morning. Good morning, Shar. Thank you for inviting me.
Absolutely. There's so many questions I have as we sit down and we have this conversation today. And I'm sure it's been on a lot of people's mind of how COVID is impacting our hearts. You know, it's affecting so many different parts of our body, but really focusing on what role it's playing in the heart. Could you give us a little overview of what can happen with our heart if one is diagnosed with COVID?
So, um, in general, um, before I before I start on talking about that part of your question, let me start with saying any medical condition or any disease condition uh, has a wide range of presentation,
Hmm.
wide spectrum of presentation, from the most mild to the most severe and everything in between. And let's take COVID as an example. Um, some people have COVID and they are completely asymptomatic. Uh,
Ah,
they just know about it when they do a test. And that's one end of the spectrum. And the other end of the spectrum can be lethal and everything in between. And the same thing goes almost for any medical condition. Heart conditions, we hear about people having heart attacks.
yes.
Sometimes those heart attacks can be very mild to the point that we sometimes call them silent heart attacks, uh,
Wow.
all the way to the an event that can be fatal. So any medical condition has that wide range or spectrum of presentation. When we talk about COVID and heart disease, it has just a wide range of how it can present itself.
Hmm.
Um, for example, many patients will, as most patients will do, when they get COVID, they have mild to moderate symptoms and they don't even need to go to the hospital and they recover within days. But if somebody has heart condition, it can be a little bit different course. We know from analyzing data from different hospitals nationwide that when patients have pre-existing heart condition, they are at more risk of having more severe COVID symptoms and even unfortunately more death. And that also brings us back to the point of prevention
Hmm.
and how can we protect ourselves and how can we minimize our chances of contracting the disease in the first place. So
Yes.
prevention is just, as a matter of fact, in my field of cardiology, I spend most of the time talking to my patients about how can we prevent heart disease in the first place,
Yes.
rather than um, dealing with a problem. Why not preventing that problem in the first place? Now, going back to what can happen if somebody has COVID and what kind of heart problem they can run into. Again, that doesn't happen in the vast majority of patients, but it happens in a smaller number of people. Um, there can be different things. One of them is heart attacks. Uh, because COVID makes us more susceptible to more coagulation problem, people can present with blood clots that can happen in the brain and give a stroke. It can happen in the heart and gives a heart attack. It can happen in the lung and give people blood clots in the lung, which can be quite serious. It can happen in the legs. So
Hmm.
blood clots can happen in different segments of the body, including the heart, and precipitating a heart attack. Another issue that can happen is inflammation in the heart muscle. We call that myocarditis. Um, Another problem that can happen is congestive heart failure, which can be quite severe and significant. There is another possibility of stress-induced cardiomyopathy. So there is just wide range of cardiac conditions that can happen when people have COVID.
That question for you too, Dr. Ashman. What happens when women get it. I know we've always heard that when women have heart attacks, it is so silent than a man having a heart attack. Are you seeing more men than women, or more women than men with some of these conditions coming in, like with COVID?
So, so there is the general answer, and then let's go back to COVID in particular. Generally, cardiac presentation in men is usually more classic than in women. So it's easier for physicians to recognize heart symptoms in men. Now, in women, that can be less obvious, and that's why we as medical professionals tend to miss heart disease in women more than men.
Got it.
So
Okay.
that's the pretext for your question. Now, talking specifically about COVID, our understanding of the disease has evolved significantly over the past year and a half. I mean, the changes, sometimes we are trying to catch up with the changes that's coming out, with the science that's
Yeah.
coming out with the disease. So, and I still think that there is a lot that we will know in the future as we go back and retrospectively analyze the information and the data that we have already. Now, have I seen in my own practice a significant difference between men and women? I have not, but that does not mean that that's not the case, because we like to separate between individual experience, individual physician experience, and a collective data. That's why we love to collect data and analyze it,
Yes, yes.
better understanding. But I have seen it in my daily practice. I've seen it in both men and women
Okay.
presenting with heart attacks when they have COVID. And many times, actually, it is severe enough that unfortunately we lost several patients when they present with heart attacks coexisting with COVID. We were able to save many, but we also lost a lot of patients. So when heart attacks happen in the context of COVID, it's usually quite severe condition.
Thank you. No, that's very insightful. And you're right. We will be, for years to come, still learning what the data and the science is going to show us, how it really has impacted how it's impacted us across the human spectrum. So thank you for that. What happens to one's heart after they recover from COVID? Is there any type of trauma, any type of after feelings, or things that could possibly occur for those that may be suffering from heart disease after they've experienced COVID?
So let me take you back to a question that we all ask ourselves: why some people have severe COVID and others don't?
Right.
And why some young people, like unfortunately, and it breaks your heart when you see that. We've seen young people who are very healthy, who have no other pre-existing medical condition, dying from COVID.
Yes.
And this is a question that we're gonna learn a lot about in the future. But there is that still unknown part, why it is more severe in some people versus the other. We know and we understand that if you have pre-existing medical condition, it puts you at more risk. But it remains a question of those young, healthy people who have severe COVID. Why? And that goes to the same question of heart conditions.
Mm-hmm.
I'll give you a few examples. I have a patient that I've been following for the past 10 years, and he has severe heart condition. And luckily, he was vaccinated. And after a while, he contracted COVID, and he had severe COVID actually. But luckily he was vaccinated, so he was able to pull through and survive that initial event. And I just saw him yesterday in the hospital, where he came to the hospital with a heart attack. And that happens almost 3 weeks after he recovered. We have seen and noticed that people, after they completely recover from COVID, and this is a personal experience or personal observation of mine, that in the
Sure.
first 3 months, things can still happen. And those things are can be cardiac events like heart attacks, or it can be blood clots in the lungs.
Wow.
And that's why when I counsel my patients, I tell them, I'm happy that you recovered. I'm happy everything is okay. But if you have symptoms that you are not sure what it is, share it with me. So I can at least, if there is something I think needs to be addressed or something needs to be investigated, at least we can address that. So when people recover from COVID, that inflammatory state can trigger events for some time after they recover from the disease itself. So again, my advice to everyone: if you have symptoms after you recover from COVID, please consult with your physician so they can help you and guide you and sort out, is that something simple that we can treat symptomatically or something that needs to be investigated?
No, that's very eye-opening, because for so long, I've heard people say, "Oh, I'm so glad, once that person's gotten over the hill." But knowing now that people should really tune into what happens after COVID, they're usually so happy just to get on the other side. And I'm sure even some of our listeners may have had family members or even individuals that have experienced it. And hearing from you how important it is to still be vigilant about our health and what we feel, even after we're, feeling like we've come through COVID, that it's still out there. It's something that we need to pay attention to.
Absolutely.
I know a lot of people think that heart disease is a problem for a lot of the older patients. What's your perspective on young people having heart disease and what happens with them when they experience COVID?
So again, in general, young, healthy people usually pull through nicely without any major issues. However, there are some people, even without any pre-existing uh, cardiac condition, who can have heart problems with severe COVID. So example, I have seen several young patients coming in with severe COVID, and then they end up with a condition called myocarditis, which is
Hmm.
inflammation of the heart muscle.
Wow.
And this is COVID can trigger that systemic inflammatory response that can involve different organs in the body, including the heart. And usually we make a diagnosis of that when they start complaining of chest pain, and then we check biomarkers in the blood, and we find that there are biomarkers suggestive of myocardial injury. We have seen that, and usually we treat them symptomatically and try to support them until they get over the disease itself. But there's another condition uh, called cardiomyopathy, or congestive heart failure. And that means that the heart muscle becomes weak, and that has a lot of chain reactions that can come with it, including difficulty breathing. The body can start filling up with a large amount of fluids, so the body can start swelling up. A lot of things that can happen with that. And again, when it happens, we treat two things simultaneously. We treat the COVID itself, but we also try to assist and help the heart to recover from this event.
Wow. Well, thank you. That's you have really just blown my mind today with all the things that we need to consider. And I tell you, months ago, we would have never even thought as individuals to be even thinking about the impact of COVID and what it has on us long term. Trying to switch to a positive note, what are the things that we can do to improve our overall health and well-being so that we can prevent heart disease and we can try to keep ourselves healthy and keep our heart, pumping as healthy and as the way we need it to be to function for us to be healthy beings? What would be some of the advice that you would give to some of your patients or to some of our listeners on things to do for the preventive side of things?
Sure. So because we're talking about COVID, my first advice is for everyone, please, if you have not received the vaccine, go and get the vaccine. I think
Okay.
it's really important, and I cannot emphasize that enough. And patients have questions. Like, as an example, some of my cardiac patients come and ask me, Doctor, I have severe heart condition. Is it safe for me to take the vaccine?
Mm.
And my answer to them, it is because you have a severe heart condition. You are the first one I want to give the vaccine to.
Yeah.
So I cannot overemphasize, if you are not vaccinated, please go and take the vaccine. Now, if you have questions, if you are uncomfortable, if there are doubts in your mind, choose a physician that you trust and feel comfortable with, and go and ask their advice, counsel them, or ask them to counsel you, and give you advice in your particular situation. I also like to say there is no one size fits all. We all have our own medical conditions, variety of medical conditions, or preferences, or fears. We all have different range of things.
Yeah.
So let's seek advice from people who understand and from people who know. So please, if you have questions, find a physician or a medical professional that you are comfortable with and you trust, and seek their advice. So that's number one. Number two, generally speaking, about how becoming cardiac healthy or heart healthy. I treat every day cardiac patients coming in with different cardiac conditions, including heart attacks.
Mhm.
And I always counsel my patients, it is a lot better to prevent the problem rather than treating it. Um, in the past 20 years, the treatment for heart conditions has dramatically improved. And we have wonderful technology and wonderful tools at our disposal to help patients with a variety of even things that we didn't even think we can treat in the past. So science came a long way. We can do, I don't want to say we can do magic, but sometimes it feels like that. This is how far technology and science came in the past 20 years.
Yeah.
However, with all that advancement, isn't it better to prevent the problem rather than dealing with it? So I cannot overemphasize the importance of prevention in the first place. Rather than using all those fancy technological tools at our disposal, just prevent the problem in the first place. And it is, relatively speaking, actually easy. It is not that difficult. The first thing is we need to take care of ourselves. We need to pay attention to what we eat and how we move our bodies on a daily basis.
Yes.
I advise my patients that I don't want you to starve yourself. I want you to eat, and I want you to enjoy what you're eating. We just need to be selective in what we eat. So I like to think of food in particular, because this is something we all do every day.
Yes.
Thanks. I like to think of food as two words, quality and quantity. And both of those things matter a lot. Okay? So, a quality issue. If I have a choice of eating chicken, for example, I can eat grilled chicken or I can eat fried chicken.
Mm-hmm.
That's a quality issue. So, grilled chicken will be better than fried chicken. If I have a choice between eating one banana or one apple versus 6 bananas, that's a quantity issue.
That's a quantity issue for sure.
Quantity matters, quality matters. Okay, so that's number one. Number two, again, just be selective in what you eat. I'll take example of lunch or dinner. I can eat some salads. I can eat some. Along with that, I can eat another portion of vegetables. And if I want to eat some sort of protein, I can eat some fish or chicken. And that would be a nice, delicious lunch or dinner that is healthy. It will satisfy most of the people, and at the same time, it will be healthy for them. I like to tell my patients to pay a lot of attention to how much sugar and carbohydrate they consume, because, as you know, we have a big issue here in the U.S. with overweight and obesity, and a lot of that comes from the way we eat.
Yes.
And what comes with that is diabetes and heart conditions, and diabetes goes hand in hand. So if we have diabetes, that can affect our heart in a big way. So can we prevent that? Absolutely. If we just pay attention to how much sugar and carbohydrates, how much calories we put in our body, it will make a big difference. So pay attention to how much salad you eat. That's a good thing. So try to make sure that this is part of your daily food. Eat vegetables. If you need a source of protein, fish and chicken are something I like to recommend. Um, Try to minimize your sugar and carbohydrate intake. So that's one advice I give to my patients. Um, I also like to tell people, if we are hungry in between meals, be careful what you snack on. Because if you snack on something that has a lot of sugar, it will, number one, it's not healthy. Number two, it will make you even more hungry.
Yeah.
So try to snack on something like nuts, for example. Nuts have a nice mix of fat and protein, and it will help you to tamper down your hunger, and at the same time, it will not affect your blood sugar as much. So that's one part of it. The other part is exercise.
My
So
favorite.
so I like to say that in order, if you have a bicycle, you need two wheels most of the time. You can have one wheel bicycle, but anyway, besides the two wheels of your bike is food and exercise. So food
Yeah.
is part. The second wheel is exercise, and it's really important. We need to get our body moving, and if we don't move our body, we can get sick. So I think of exercise as a necessity. I don't think of it as luxury or something that if I have time, I will do it. No, I don't think of exercise as such. It is something important that you need to carve out time from your busy life and busy daily schedule to do it, because it's not something that if I have time, let me do it. No, it doesn't. In my opinion, it doesn't work that way.
So true.
But it need to be maintained and taken care of. And I am totally convinced that if we pay enough attention to these two things only, how we eat and how we move our bodies, a lot of diabetes will disappear. And with that, a lot of heart disease will go away.
I agree with you 100%. And I tell people exercise is a way of life. We really have to move towards that, and we have to schedule it. We have to really be intentional about our schedule. And you're right. And it can't be something I'll try to get around to it, but it's something that we even try to do here in our office, try to go for a walk, even in the middle of the day, just go around the building, you got to move. And I think that is very well said. So thank you so much for this great conversation. And we're out of time for today, but I think our listeners got a lot out of the conversation. Any final closing statements you'd like to make before we log off today?
I'm just quite hopeful and optimistic that that we will. I'm hoping that we will be putting the COVID behind us in the near future.
Yes, I'm with you on that one. I think we all can agree.
With more people being vaccinated, so I'm hoping that we will achieve that in the near future. And again, we all pay attention to exercise and eating good, enjoying our life. I think
Yes.
we will do better.
Sounds good. For those of you that would like to connect with Dr. Osman after the call, he can be reached through Broward Health Medical System. And my name is Charinus Davis, and I am signing off for Chamber Connects.
Thank you so much for inviting me, Sharina.
Thank you so much.